for the organization in Houston, and am super excited to be with you today, but really more excited to be able to bring to you three of my fantastic, fabulous co-presenters. So I'm going to give you a little bit of a stage setting of what the doula expansion program throughout Houston, otherwise known as DEPTH, is about, and how we know and why doula care is important to our pregnant individuals and to their support people and to building their families. So at March of Dimes, we believe that it is important to improve our maternal and infant health outcomes using an equity and a social drivers lens. Everything we do is data-based, we are results-driven, and we are focused on really mobilizing our communities, hence the work through collective impact. And our vision for everything that we do is to we imagine this world where every single mom, every single birthing person, sorry about the timing, and every single baby are healthy before, during, and after pregnancy, regardless of their race, of their wealth, or their geography. And so through the initiative that March of Dimes is serving as the backbone for, we have a statement here in Houston that says all women in Greater Houston attain optimal health in all phases of life, including healthy birth outcomes. We work in 3 different strategies that you can see down there in those larger boxes, but our work is guided by the 50+ organizations and individuals who are part of the work to really help us develop programs and activities that we can all do together collectively through collaborative measures that we otherwise wouldn't be able to do as individual organizations. And so as this work came about, one of the questions and one of the elements that we wanted to explore in Houston was about doula care. And so what's a doula? This may be the first time that you're actually hearing that word, and you may have a preconception notion about it. You may have no idea what it is. I'm going to give you what I'm going to say is the textbook definition, but I'm excited that Dallyda, who went through the DEPTH program this past year and is a doula, is going to share more with you about her why and the work that she does with our moms and our babies. And so a doula, this definition comes from Dona International. They are a international organization. They are one of an international organization that certifies doulas through their program. It's a trained professional, and they provide continuous physical, emotional, and informational support to their clients before, during, and shortly after childbirth to help them achieve the healthiest, most satisfying experience possible. A doula, it's important to note, is not a medical professional. A doula does not perform any medical tasks. The doula will not diagnose or treat in any type of modality. The doula is considered part of that care team, part of that birth team, because we know that it is to have that trusted individual that you can go to. Many doulas make themselves available 24/7 to their clients via text and email. And so sometimes, those moms or those partners have those questions. And, I don't necessarily want to be asking my physician or my nurse or my social worker or even potentially my community care coordinator or community health worker, but I want to talk to my doula. And so the doula will do educational planning with the partner and their clients. They will meet during that prenatal time. They may provide comfort measures during labor and delivery. They are providing that continuous support that you'll hear a little bit more about through that emotional support. And they'll also provide advocacy assistance for the client, for the patient to then be able to advocate for herself and for the partner to be able to advocate for that individual person. They will not do the actual advocacy for the client, though. They are there to help provide, again, that continuous support. They won't speak for and they won't make decisions for the client. So what are some of the benefits of a doula? There are many studies out there. The most comprehensive one was done back in about 2017, 2018, that did a literature review of doula studies across the United States. That's probably the most comprehensive one that has been available and that is out there at this point in time of looking at all of the literature. And we know with all of the doula work that has been happening across the United States, there's more research coming out each and every day. So we are excited to have some of this updated. But a doula, part of having a doula, and that we have seen in clinical outcomes, as well as outcomes for mom, having a healthy mom, and then as well as outcomes for having a healthy baby, because those are all three different things, but they're all part of that birth experience that the individual is receiving. So some of it is the quantitative measure. So doula care has been shown to provide decreased cesarean rates. It's also been shown that there are babies who are born full term versus preterm. We know that there are qualitative measures as well. The woman may experience a better patient experience in the hospital setting, but as well as in the prenatal and the postpartum time. We know when mom is able to start breastfeeding and then continue that breastfeeding for a continuous amount of time with the infant and with the baby and with the infant, we know that leads to a healthier baby. We know it leads to decreased time that that baby may have to spend in a healthcare setting with a physician, or even going into the hospital. We also know that our moms, those that are in our racial disparity groups, we've seen that reduced inequity for our African American and for our low income communities who are able to access a doula. However, a doula currently under both many commercial plans, under Medicaid in Texas, a doula service and her services are not covered by health insurance. It is typically an out-of-pocket cost for an individual to hire a doula. Additionally, for an individual who wants to go through the doula training, that is an out-of-pocket cost. And sometimes that is untenable for individuals who wish to go into birth work. You can't simply, for higher education, you can apply for a scholarship, or you can get a loan. You can complete a FAFSA. You can't get that to go through doula training. And so we, through our Collective Impact Initiative, wanted to say, how can we help increase our doula workforce capacity here in Houston for our women of color, as well as how can we provide those doula services to our low income and under-resourced individuals through a way that can really reach those who are in some of our most vulnerable settings. And so together, in collaboration with the partners that you see on this screen who make up the Doula Workforce Initiatives Group, Harmonious Birthing, Maternity Journey, Push Birth Partners, Sanika the Doula, Paradigm Doulas has come on board this year, as well as Vibrations of Soul. We developed Depth, this doula expansion program throughout Houston, where we are increasing the number of doulas, as well as increasing the number of individuals in Harris County who have access to a doula. You're going to get to hear a little bit about Dallyda's journey, as I said, as well as you're going to get to hear from two individuals who referred their patients, their clients, their members to receive those free doula services. Every single doula who went through the training cohort in 2023 and the 8 individuals who are in the 2024 training cohort, and then the individuals who will be in our 2025 cohorts, yes, that is coming, they each have the ability and opportunity to embrace a practicum experience and provide their doula services for prenatal, labor and delivery, and the postpartum journey to 3 individuals. The criteria for who can apply for these doula services, fairly simple. We didn't want to make it too onerous. You need to live in Harris County. You need to plan on delivering at a hospital that is located in Harris County. We really wanted to reach the most vulnerable of our individuals. So we asked, do you have Medicaid? Are you on CHIP perinatal? Or are you Medicaid eligible? Essentially, if you're 200% of federal poverty level or below, you're eligible for these services. And then because the training does take some time and we want to ensure that our doulas who are brand new to this work are getting that training first and then being able to dive into the services they're offering to the community. The estimated due dates for these clients that we will be taking for 2024 is going to be between June and September. And so right now, some of you may have some clients who are in that time frame, because we know that is right about right now when they are starting to get pregnancy tests, starting to enroll in Medicaid, starting to seek their prenatal visits. This program may be for your clients. We also ask that the individual be 18 years or older. And so our request for doula services that you will hear a little bit more from both Tianca, who referred her clients to the program last year, as well as you'll hear from Monique, who worked with one of the Harris Health clinics to refer those patients to the program. You're going to hear about how they did that with their clients. And then I'll come back to you in a little bit and I'll drop this link into the chat. We will start accepting applications for this 2024 cohort starting on March 4th, which is after the doulas will go through their training. And so, as I said, I'm really excited for you to hear about the experiences of these three individuals. So please welcome Dallyda to our virtual platform. And Dallyda just completed her training and everything through the depth program. And so Dallyda, it's your floor.
Thank you, Alicia. Good morning, everyone. Thank you for this opportunity to speak with you about my experience with the depth program. My fondest memory of my mother was me witnessing her give birth to two of my brothers while we were living in a refugee camp in Lusaka, Zambia. So without any resources or tools to ease the process of labor, my mother had a village of women from the camp who worked together and using their knowledge and wisdom that's been passed down from their ancestors, they used all of that to help my mother give birth to my brothers. So just witnessing this unity and togetherness was such a beautiful experience, because when I was looking at my mother at that time, in that moment, I did not see any fear or panic on her face. She entrusted that wisdom of other women in the camp to come together in that with that unity and togetherness to aid her in giving birth to my brothers. So when I became a doula, I wanted to have that experience. I wanted to share that experience with my clients. I wanted to have a space for unity and togetherness for my clients. So outside of providing just supports and resources and tools like Alicia had mentioned, I envisioned a community much like what my mother had in that camp. But I didn't know where to start. I just had this vision and I had this goal in mind, but I didn't have a starting point. And I knew I wanted to work with Black and Brown birthing persons. So I started looking into how can I be a doula and do this full time. My then coworker told me about this opportunity with March of Dimes, and she encouraged me to apply. And when I looked into the program and got more information, I could not miss the opportunity to pass by, because this is exactly what I needed to start the process of becoming a doula and provide the services to my community. And what a process it has been. My experience with the death program has been phenomenal. It's what I needed to set a foundation for what I am doing right now as a doula and to start my business. The cohort provided me with a mentor. It provided me with the training, the resources, and the tools to guide me through what I needed to do to become a successful doula. My mentor, she was phenomenal. We met monthly, but she was available 24/7. I could text her or call her or meet with her in person to just seek her guidance and her wisdom and support in what I needed to do to ensure that I was prepared to provide doula services to my clients. I felt supported, and she gave me all the support that I needed 100%. I sought her knowledge and wisdom and just everything. I was hungry, and I'm still hungry to continue learning more about just how I can be the best doula for my clients. So during this journey with March of Dimes, I have been successful. I started my journey in July when I trained with Harmonious Birthing, and I just completed the death program. And in that 6 to 8 months, I have set up my nonprofit business, which is Pamoja Doula and Birth Services. And like I said, I've been successful in the 6 to 8 months. I don't mean financial success. What I mean is I've been able to build something that I thought it was impossible. And because March of Dime has been able to provide the resources, the trainings to allow me to become a doula, to me, that is success. And like I said, my nonprofit is Pamoja Doula and Birthing Services. And Pamoja is a Swahili word for togetherness, for unity. So I wanted to tie my business back to where it all started, witnessing my mother give birth, and she was surrounded by a village of women who were giving her wisdom and support and guidance to make sure that her birth was positive and it was not traumatic. They ensured that she received everything that she needed to make sure that my brothers and my mothers were healthy in that process. So with my clients, I provide educational support, emotional support. I encourage autonomy. I encourage them to use their voice to advocate for themselves. And in the whole process that I'm working with them, I am hands-on. Again, I tie it back to we are partners. We're in this together. This pregnancy, this birth is much more for you than it is for me. So I ensure that they're understood, they're heard, they're receiving the resources, they're receiving the support. And March of Dime has been able to connect me to outside resources, and other support that I seek out in order to assist my clients in the process. So with my business and my vision, my clients and I work together to ensure that their birthing vision is honored. And I'm just beyond grateful that I have went through the death program with March of Dimes and all the partners that made it possible for myself and my colleagues and all the future doulas. But my journey doesn't start here. I feel like my journey is just starting. Yes, I have my nonprofit Pamoja, and it's donation-based. And I wanted it to be donation because I wanted the doula services to be available to all women regardless of income. But my main focus is low income because I wanted my clients from that community to be able to have quality doula care, quality medical care when they're at the hospital. And again, just to have their voice heard and understood, and overall have a very positive outcome when they birth their babies. Like I said, my journey is just beginning, and my next goal is to make Pamoja 501c3 in the next year or two. So thank you so much for your time. Again, my name is Dallyda Tatchi-Banda, and my business is Pamoja Doula and Birth Services. So if you have any clients who are seeking doula services, please ensure them to look into my information, and I'll be more than happy to provide the services. Thank you again for allowing me to speak about my experience with the DEATH program.
Thank you, Dallyda. So excited for you and congratulations.
Thank you.
Okay, our next speaker is going to be Tianca. Tianca's with the Council on Recovery. She is one of their community care coordinators and a community health worker. And Tianca referred a couple of her clients and they applied for services last year. So Tianca, would love for you to talk with these folks about like the why you recommended to your clients, as well as how you talk to them about a doula and what that would bring to their birth experience. And then anything else you want to share with folks?
Awesome. Thank you so much for having me this morning, Alicia. Good morning to everyone. The story starts really with myself and my personal experience as a mom and what that journey has meant for me. That's really when I got into maternal health and birth work and stuff of that nature. And so when Alicia brought this program to our attention, I was so excited because I just knew how important having a doula is and was, and how it is something that is so beneficial for a mom, especially a mom who may not have a strong support system. Because I really feel when you're going through the birthing experience, especially as a first-time mom, and even as a second-time mom, you need that support around you. You need that person in your corner that's going to help you ask those questions, that's going to guide you to advocate for yourself in a way that you may be fearful of doing alone. So when Alicia presented this program, I said, this is an amazing opportunity because we know that sometimes having a doula can be costly. That could be a barrier for a lot of women as to why they don't get one, because it can just be one of those things that we think we can't afford it. And is it really necessary? It seems like a luxury sometimes. But for me, a doula is a necessity, is a person that is in your corner that you don't realize how much you need them until you go to those doctor's appointments, and it could be very intimidating. I remember when I was pregnant with my son for the first time mom, I was older mom, but I was still a first time mom, and not knowing what questions to ask, not feeling like I'm rushed through the process. And having a doula there can give you that person in your corner that's going to help you ask those questions, that's going to guide you to, you can ask this, don't feel like you have to be pressured to be rushed, take your time. They give you that extra layer of support. So when Alicia presented this opportunity, I said, you know what, I cannot wait, because I had a couple of moms on my caseload around the time that they would be eligible for the program. And they were both high-risk moms or had previous high-risk pregnancy. And so that presents even more of an opportunity to have a doula by their side. And so when I was presented with the opportunity to give them this great service, I was excited, because being able to have a doula that's completely free of cost, that is just an amazing gift to receive. And so for me, the process was very simple because I knew how important a doula was. It starts with education and just seeing what they know about a doula. And seeing where their knowledge of what a doula is and the services they provide starts. And so it started with just education of why having a doula is important, and then introducing them to the DEP program and letting them know that the service is free. And once they heard it was free, they just couldn't believe it. They were like, where do I sign up? And so, I walked them through the actual application. They signed up. It was straightforward, very simple application process. It's not complicated at all. So we walked through it together. And, I stayed with them through the whole process. Once they got their doula, I would check in and say, how's it going with the doula? And every time I checked in with them about the doula, they were like, oh, it's awesome. It's great. She's really helping me with this. She's helping me with that. So it was a great experience for both of my clients that have gone through the program. And it's one of those experiences that if you have the opportunity to refer a client, do refer your clients to this program because it is an excellent resource. And they get a lot out of it at the end of the day. I mean, and it really does help them to elevate their voice in a system that could be very complex, that could be very complicated, and that can be very intimidating for a lot of women, especially our Black and brown moms who oftentimes just feel pushed to the side and not heard and not listened to. So opportunity like this to have a strong advocate and a strong support system in your side is just detrimental for a lot of us at the end of the day. So thank you everyone for letting me speak to you all this morning. And yes, this program is just an excellent resource for our community.
Tianca, we appreciate your support and your advocacy with your clients to encourage them to receive a doula. And so our next speaker is Monique. And as I mentioned earlier, or as was mentioned, Monique is with Ben Taub. And Monique really helped to set up a relationship between one of the Harris Health clinics and the hospital to apply and to have some of those folks receive doula services. So Monique, I'll let you talk about your experience and your why.
All right, good morning. Oh my God, it's so great to hear everybody and the enthusiasm. I'm like, oh my goodness. I'm sitting here and my heart is beating real fast. So it's very interesting because I took a different route, as Alicia and Adele and everybody knows. I actually was exposed to or started researching for the Ben Taub inaugural Black Maternal Health Week. I worked with a group here at the hospital to put that on. And through that research, the doula kept coming up. And so I don't know how I received an email and I applied to be a doula with the March of Dimes with the DEP program. Of course, I didn't get it, but that was okay. They offered a discount for people who still wanted to do it. So if you applied and you didn't get in, then you were able to still go. So I was like, oh, okay, well, let me go ahead on and do it. So I'm actually been trained by Harmonious. I was in the class with Dilla, and I'm also a certified doula with them. But within that training, working with the community doulas, the most amazing part, being one of two medical professionals in there, is the feedback. What everyone was talking about, what the needs were from the hospital's perspective. I think Joanna was in there with us too from Push. I see you. And so just hearing it, and I know y'all remember for that weekend, having to say, yeah, the hospital needs to do a lot more work. Yeah, you're right. We need to really work with the community more and really, change the atmosphere for our people of color, Black and people of color. So I actually went through the entire weekend, went through the actual training, which gave me a lot more of a perspective, right, on, oh my God, we got to do this, guys. We got to do this. So what I did is, I'm not gonna lie, I just Googled, what has the highest zip code with the need for doulas, right? Where is the biggest need? And guess what? MLK, our Martin Luther King Clinic Health Center, was one of the zip codes that had the highest racial disparities. So that's where I, on my little own, just went to the clinic and was like, hey guys, there's this program, DEP. We need to really get our patients and start signing them up. Fortunately, MLK has not only OB, but they have a nurse midwifery program. And so with the Baylor midwifery program and working with the doulas there, working with the midwives there, I just went, educated the MLK clinic, the health center, the people that work there, talked to the doctors, Dr. Greeley and Dr. Lakey. I spoke with Mary Trop, who was also the midwife there, and everybody was excited about enrolling. So I was able to keep the flyers there. I even brought them. I said, y'all don't even have to work at it. I'll just put them up. And so the patients just scanned the QR code and boom. We had at least, 4, Alicia? I think 3 from MLK and at least 1 from our high-risk OB clinic. And so I would just go there maybe every other week just to remind them about the program. And so it was really successful. Another thing that was really exciting is that the doulas actually reached out to me when they came to Ben Taub. So I was a resource for them. They were able to say, hey, I'm here with the patient, with one of the patients, can you give me some feedback? Like, just to kind of help them work out. So like Alicia said, I worked not only with the clinic, but I was also working with the doulas, and actually getting our administration on board here at Ben Top to really see the importance and the need for our patients. I remember one of the doulas coming to me and she said, Monique, the patients at Ben Top really need this. I said, well, okay. So what we're doing here at Ben Top is we're putting on an educational offering during Black Maternal Health Week to really get the doulas in to do a mix and mingle, to meet with our physicians, to meet with our residents, to meet with our midwives, our clinic people. And I intentionally aligned it with the March cohort for March of Dimes so that everybody can meet, strategic. But we want to make sure that the community knows and people understand. The biggest misconception when I say doula is, oh, is that a midwife? And so there is definitely a need to understand what a doula is, what the purpose of it is. And it's really been a very rewarding, even for myself, practicing, outside of Harris Health as a doula, to really get a great understanding of what a doula do and how that impacts every delivery and every mom, every birthing family. I always say with my staff here is one thing a woman remembers from day one to the rest of her life is the day she had her baby. That will never leave her mind. It didn't leave mine. I'm a one and done, but I definitely remember every minute from the time I got to the bed to when I went home. And even thereafter. So I think I am a strong supporter of the doula program. Ben Top, Harris Health, we're working really to find resources like March of Dimes to really get our patients to a doula and get it at no cost to them. And so we will continue looking for resources in the community, working with the community, working with Alicia, March of Dimes, and ensuring that every mom goes home and her baby together safely and have a positive experience. Thank you guys for giving me the opportunity to speak. I always speak about this, so thank you.
Thanks, Monique. We appreciate your support and all that you are doing with the folks you work with. So what does someone get when they sign up for these free doula services? For those who've already explored the website, you've probably seen it on there, but definitely for those that aren't able to, want to make mention. The individual will get an initial 30-minute consultation simply to make sure that they understand what a doula is. And again, a doula is not the medical professional. That individual is still going to need to keep her physician or her nurse midwife as that OB/GYN delivery individual. Once everyone agrees to move forward, the birthing person will get 3 prenatal visits. And typically those are anywhere from maybe 45 minutes to an hour in a virtual visit on upwards to 2 to 3 hours for an in-home visit. With those 3 visits, we do ask our doulas that one of those is at in person. So that you can get to know the individual. The 2 other visits are mutually decided between virtual or in person. And I'll let y'all know, I'll spill a little bit of our outcomes data already. Our group last year did about a little over 50% of the visits were virtual. So you can equate that to kind of be 1.5 of the visits were in person. So therefore 1 or 2 visits were in person and then 1 or 2 were virtual, mutually decided between the doula and that family. The doula will then support the individual at labor and delivery. And part of that conversation in those prenatal sessions is, when do I call my doula? When do I go to the hospital? But then when do I call my doula? When does my doula come to the hospital to provide that continuous support for me? Because we also know our doulas they're human beings. They are not superpower, and they cannot be present for, say, 24, 36, 48 hours of labor and delivery. And so we really want to make sure that they're able to time themselves appropriately for when they meet their client at the hospital. Yet at the same time, each of our doulas in the program has a backup doula. She is paired with one of the other individuals who is in the program. So if for some reason she has been there for that extended period of time, just as a doula does, she will call in her backup, and she will also make sure her client understands that she will be calling in her backup doula during those prenatal visits. And we had, over the course of our 18 births this past year, we had 2 individuals who utilized their backup doula. So it does happen, but there were at the same time 16 of those who were able to be there fully for the entire labor and delivery. She will then also stay with the mom and family and baby in that immediate postpartum time. The timing for that really depends on what's happening with the client, if she went to have a C-section, if she's in recovery. So it's anywhere typically from 2 to 4 hours after that delivery. And then, as one of the doulas has said, the secret sauce is that she will do postpartum visits. We know, according to what everyone says, is the mom doesn't have her first postpartum visit with her OB until 6 weeks. Y'all, we're working on that. We're working on changing that. Thank you, Texas Medicaid, that is giving us 12 months postpartum extension that I can talk to y'all about at another time. But the doula typically will see mom postpartum within that first week after delivery of the baby. And so with the 2 postpartum visits that she will provide to the client, we ask at least one of those to be in person. The other one, again, can be virtual or mutually decided upon between the client and the doula. And what we actually found this for the cohort from last year is that about 2/3 of the visits were in person. So there were many of our doulas who are making both of those postpartum visits in person, which we know is just that extra touch point, that extra visual of how are things going. Also, as we know, for navigation and our community health workers and community care workers and our home visitors, having that eye on what's going on inside the house. What are some other of those potential elements that maybe should be addressed that can help provide additional care for mom, baby, and family? And so, yes, all of this is free. The doula is being paid for her services because we want to make sure that she is able to help build her business and start off on the right point. And so it is thanks to these funders that you see on the screen. Last year, CareSource Bayou Health, Humana Healthy Horizons funded our program for 6 doulas. This year, HCA Houston Healthcare and Molina Cares is funding our program for 8 doulas. And then next year, we have funding from Quest Diagnostics Foundation already to build our initial set of doulas and are looking for some additional funders to help us increase that training cohort for next year. So if anyone's interested in funding, I'll put that out there as well. We would love to talk to you. But it is because of them that we are able to provide this service to our doulas to help them establish themselves to be successful, but also to provide these services to our community, to those who are the most inequity or the most inequity exists here in our community. So with that, I will stop sharing and we'll open the floor for questions, Wes.
Absolutely.
I have a question. Can you guys hear me okay? Okay. First of all, wonderful presentation. Thank you all so much for putting this on. I'm curious, Alicia, about the capacity for this year, and maybe that was outlined in what you mentioned, but both in terms of doulas you're hoping to train and then also patients you're hoping to serve.
Sure, yes. So we have 8 doulas who've already been selected as part of our training cohort. They are getting all of their initial stuff in, and they'll have training in 2 weeks. And then each of those 8 individuals will serve 3 clients with an estimated due date between June and September. So when you do the math, it's 24 burrs that we have available. So definitely encourage y'all to talk with your clients. I'll let y'all know last year, it took us a couple of months to fill our spots because we did have some individuals who we couldn't get in contact with. So then we went back to those who had applied to say, we didn't have room at the time. We now have a spot available if you would like this. So the website that I put in there in the link in the chat will keep updated with how many spots are available. So you can always look on there if there's a berth available on the website. Casey.
Thank you. Good morning, everyone. This is really great. I have one question, and I think all three of you all might be able to answer because it sounds like you all provided doula services before DEP started. And so I'm curious to know what the experience has been like in the hospitals after kind of being a part of this program. So maybe some before and after. You all don't have to respond, but I am curious to know what tools you all feel like have helped you to navigate just the healthcare system a little bit better by participating in this. Thank you.
To speak on that, I think for me, just having a more inside look as to what the healthcare system looks like has been greatly beneficial. Knowing your rights as a patient, of knowing that you do have the time to ask the questions that you need to ask, and being able to stand firm on that, and having the information to kind of back up your questions and support how you're feeling. And to know that, you know, you do have body autonomy and stuff of that nature is greatly beneficial in this work and as a patient yourself. So I think for me, that's one of the things where when I started doing this work, being able to work inside of different hospital systems and getting to know the staff there and the doctors and the nurses and everyone there. That way you feel more comfortable with your surroundings and being able to ask certain questions.
Yeah, I can also echo what Tianca said. At the hospital setting, definitely just encouraging clients to know their rights. And then also as a doula, just establishing those relationships with the staff. Because oftentimes we do see that some hospitals, there's this pushback between doulas and medical staff. And it's like us versus them, but it's not us versus them, it's us together. And our main focus, our main priority is the client. So what can we do together collectively to ensure that the client is being heard and understood and receiving proper care, quality care? Whereas at the birthing center, it's more holistic. And in my experience, the client has more of a voice about what she wants to have during the labor process. It's not as stressful, because not a lot of it's not a lot of staff coming in and out of the room, a lot of just other stressors. So she's more laid back and she can focus on the labor. So that's been my experience between the hospitals and like a birthing center.
So I can say I've been a labor and delivery nurse for 27 years. So this has definitely opened my eyes to a lot more of what needs to be done. So I will say that. So for me, as a labor and delivery nurse working, there's a lot of things when I became a doula that I did not understand. That I went into it with, oh, I need to make sure they know all of this. But there's a lot of gaps. When you think of the prenatal schedule, I go and see my doctor once a month, but to a certain point, then every 2 weeks, then every week. I think the benefit of helping my client navigate the system, right, in a better way, I think has been advantageous for them. So I know labor. I know how to work in the room. However, planning, I always felt that they just didn't know enough. And so to be able to say, hey, when is your doctor's appointment? What are some questions you have? This is what we should be expecting at this visit. And what are some questions based on that? So I think for me, it has definitely changed my view and my perspective. And I've always been a nurse that allowed my patient to make decisions, but now to arm her with the tools, she's more confident. And that's the feedback that I receive from them. It's like, I'm just more confident. I'm not as anxious. I'm not as nervous, right? It's because now I have the knowledge. And so that's really the key, is having the knowledge and walking in with that confidence. And it's not against the medical profession. It's just saying, hey, well, what about this instead? So I said, definitely I have a broader view from prenatal, because prenatal was really my challenge, right? Because I only see you when you come to the hospital ready to have your baby. So I would say that that's my biggest thing, is helping them navigate. Hopefully I answered your question.
Real quick, Cara, I see you have your, sorry if I'm saying your name wrong, if it's Cara. Felicia just asked, will the contactor, can you all, is it okay to share your emails or contact information after the presentation?
Are you asking
Okay.
me?
Felicia had asked it, and so I just wanted to make before sharing, and yep, I'll turn it over to you. Cara.
So I know Alicia pretty well, and I was really kind of unaware of the details of this. So kudos to y'all. Congratulations. I think this is amazing. And I put this in the chat and a couple of people put hearts by it, but right now we're doing a training with University of Houston's Community Health Worker Initiative on upskilling community health workers by introducing them to mental and behavioral health strategies that they can use with individuals and communities, but we are not limiting it to community health workers. Doulas could attend. So if you're interested, please message me and let me know. I can also send the information to you, Alicia. And then my other question is, do you have Spanish-speaking doulas?
So yes, we did have a
Good.
Spanish-speaking doula in the cohort last year, and
Okay.
she actually she was paired with 2 Spanish-speaking individuals. This year in our cohort, we have 2 individuals who speak Spanish. And one of those individuals actually speaks a couple of other different languages. And so we might, maybe, I'm not promising anything, y'all. We might have some additional languages where we will be able to offer doula support. That will be obviously up to her if she is comfortable in doing that. Also, Cara, I did want to mention something based upon your comment about community health workers. So again, those on the call may or may not know, a doula, there is no national certification. There's no state certification for doulas. Our doulas that have gone through this depth program have been certified by their trainer, Harmonious Birthing. And she has a set of competencies that they have to prove before she provides them with her certification. And so there does tend to be there's a lot of conversation right now in the state around community health workers, around doulas, around peer supports, and how do we support our birthing families, because we know maternal mortality and infant mortality in Texas, unfortunately, is on the rise. And this is one of the ways we believe in the community that we can address that, especially with our women of color, our Black and brown women. But a doula is not a community health worker. A community health worker is not a doula at the same time. So, you know, we appreciate the Health Equity Collective in letting us have this stage to provide the information of what a doula is and what she does and does not do.
right? But wouldn't it be incredible if they were dual certified, right? And I think there's a lot of advantages to that.
There is, and I'll put a pin in that, Kara, and come talk to me in like a year-ish, maybe.
We're going to set up a meeting for sure.
Wes, you're on mute, or something's on mute.
Sorry, I have both open because my connection kept coming in and out. Apologize. I wanted to just show our Mighty Networks page, and particularly the page we have about maternal, infant, child health. There's been a lot of rich discussion, and if events come up and other things like that, I just want to draw attention here where you can post that. So this has been a great session, but this is only the beginning of a lot of work and conversations. And just know, of course, thank you again to all the speakers. And yeah, I just encourage everyone to check out this page. We'll post the recording here and the resources discussed in the chat and on our YouTube channel as well. So a huge thanks. And yeah, with that, I wish everyone a happy Thursday, and thank you.
Thank you.
Thank you. Have a good one.